Sitting comfortably with your spine gently upright, shoulders open and then relaxed. Closing your eyes or gently lowering your gaze. Feeling the contact points of sitting, feet on the ground, contact with the chair, position of your spine. And then bringing your attention to your breathing, or if you prefer, picking one of the contact points, your feet or your sitting bones on the chair, and focusing on the sensations in that area moment to moment. With the breath, following the breath at either the nose, the chest, or the abdomen, or the whole flow of the breath in the body, and following the sensations moment to moment. And as your mind drifts away, gently coming back, just acknowledging and noticing where it's gone, and then with kindness returning to the breath. Following the beginning, middle, and end of the in-breath, beginning, middle, and end of the out-breath. Following the sensations in the contact point from moment to moment. Tingling, warmth, pressure, relaxation, whatever you feel. And this is a practice for anyone experiencing adversity or difficulty in mindfulness practice. So this could be your stress rises to the surface when you sit, or your mental health challenge gets worse, more anxiety, more depression, more obsessive or worried thoughts, or you're experiencing depersonalization, dissociation, anything like that. You don't have to sit with adversity, but you can continue practicing mindfulness and skills to support you with that. So the first option is to move into dropping anchor. So dropping anchor begins with acknowledging your thoughts and feelings. Notice and name what you're going through. So you might say, I am noticing overwhelm, or I am noticing panic. I am noticing detachment. I am noticing anger, sadness, fear, disgust. Whatever you're experiencing, name it, open your eyes. If it's numbness, say, I am noticing numbness or detachment. And then come back to your body. So feel your feet on the ground, maybe push them into the ground, straighten up your spine, open your shoulders, do a bit of movement, roll your shoulders, start to stretch, start to move the body, being mindful of coming back into your body, even with the difficult thoughts and feelings there in the background. So getting a sense that you can control your body with any difficult thoughts, feelings, detachment, anything like that. And then engaging in what you're doing right now and the world around you. So look around you, notice and name 5 things you can see. Maybe notice and name 3 things you can hear, touch, smell and taste if relevant. And then focusing back into what you're doing. So we could move back into the mindfulness practice at this point. Give it another go. And then if needed, move back into dropping anchor, acknowledging the difficulties, coming back to your body, engaging in the world around you and what you're doing. We might move through a few cycles of this, teaching our mind that we're safe in this practice and that we can have control over our body, our actions and our attention, no matter what is happening. So coming back to the breath or the contact points now. The next option is to move into supportive thinking. So we'll start with values, connection and goal setting. So first of all, picking a value you want to connect with, a core value in either your relationships, your work, your play or your health. So for this example, thinking kindness in relationships. So saying to yourself, I want to be about kindness. And then thinking of 3 things you can do today, 3 actions, setting goals for today, what you can do to live that value for yourself and for the world and others. What can I do for myself that's kind? What can I do for others? And you reflect and you think about that. And if your mind goes on to the difficulties, you acknowledge, you notice that, and you come back to that reflective thinking, that supportive thinking. Now you could also move into gratitude practice, so focusing on gratitude or loving kindness. Thinking about the people in your life you want to bring loving kindness to. Thinking about those people and saying the phrases like, may you be safe, may you be healthy, may you be happy, may you be loved. Or with gratitude practice, going for 3 good things from the day or this moment right now. So we're connecting with concepts and reflection and thinking, moving from pure awareness or body awareness or moment-to-moment awareness. And we're moving into a practice with reflective thinking and focus. So spend a moment now with gratitude or loving kindness. And we can combine these options, so we can move from our mindfulness practice into dropping anchor, coming into our body with reflective and task-focused thinking. So we can start to take action, do a task and use our mind to support that. So narrating and talking through what we're doing, or doing some reflective strategic thinking or planning or analyzing. So doing any kind of thought that will support a task. And this can be so helpful if we're experiencing dissociative symptoms like our mind is blanking, or the world is feeling unreal, or we are feeling detached and unreal. So to move into that kind of thinking can be really helpful. And none of this is done as distraction, because when things are intense we can't distract, but it's done as an anchor to ground us, to really focus on what matters, what's important, or at the very least this present moment and what we're doing right now. So if you're experiencing more of the dissociative experiences we talked about, you can actually even narrate out loud your thoughts. That can be a useful tool. So you use the drop and anchor practice, you use supportive thinking, and you actually say the words out loud to get that part of you back on board and working. So moving back into your mindfulness practice, your breath, or the contact points. And it can be good to rotate between these practices, a little bit like physical exercise when you're working different muscle groups, different skills that support each other. So you can continue with your practice, and if you need to, go back to dropping anchor or supportive thinking like values and goals and actions, action planning, problem solving, strategic thinking, loving kindness, compassion, gratitude, savoring the present moment, narrating what you are enjoying, what's good about it, and then moving back into the mindfulness practice and moving between them a few times. Always knowing you can get up and move and do something active, and that can be just as valid a way to train your focus and your acceptance skills. Now just taking 3 deep breaths. And opening your eyes and orientating yourself with the room, looking around you, noticing what you can see, what you can hear. And taking these values into your life of focus, connection, compassion, kindness.